This is my presentation on older adult or video presentation. For this assignment, my interviewee has chosen to discuss Erikson's biopsychosocial theory of development, stage 7. In Erikson's stage 7 of development, Erikson discusses generativity versus stagnation. During generativity versus stagnation, the individual focuses on the well-being of others around them. The generativity model. In the generativity model, it consists of inner desires and cultural demands. During this stage, older adults enjoy to volunteer and help their future generations. Individuals who have shown more concern for generativity have reported to be happy, positive self-esteem, and have goal stability. When individuals are not able to do so, they become self-absorbed. Important life experiences the interviewee spoke about from their adulthood stage is when they became a grandmother and a great-grandmother. The interviewee was able to be present for the birth of their granddaughter, but feels a biological difference played a role in not being present for the births of the other grandchildren. The interviewee believed that due to the role of being a step-parent, she was not included in the other births. The interviewee was understanding of this and was just happy and thankful to live long enough to see her grandchildren and great-grandchildren growing up. The interviewee was baptized again with her late husband in a church setting to begin a new walk with Christ. She began reading the Bible every night before bed with her late husband and attends church on the weekends she is off from work. Religion and spirituality are viewed as good for the individual's life, for health, relationships with others, and coping with life's difficulties. Another positive that the interviewee faced was moving out of a negative neighborhood, which was in a bad environment, and into a nicer neighborhood, into a positive environment. One challenge the interviewee faced during her adulthood stage was the loss of 2 children. One son passed away due to cancer. This was extremely difficult for the interviewee to cope with. The second loss was of her stepson, who she had helped raise from a young age. He passed away from suicide. The interviewee stated that this was also a difficult loss for her. Another challenge the interviewee faced was dealing with depression. An accomplishment for the interviewee was made in their adulthood stage when they got their GED at the age of 55 years old. Another accomplishment for the interviewee was becoming a grandmother and a great-grandmother, which she looked forward to teaching them about God. The psychosocial crisis of the interviewee adulthood stage would be the loss of her 2 sons. Due to her loss, this caused her to begin to experience depression. The interviewee is then not making their mark in society by creating or nurturing something that will outlast them. At this stage of adulthood, an individual's development within relational and occupational contexts requires adequately maintained cognitive engagement and abilities. However, failure can lead to social isolation and loneliness. The interviewee struggled with factors from the psychological level which inhibited the resolution of the psychosocial crisis. The interviewee has a low self-esteem, which contributes to the depression. The interviewee was raised in an environment that mental illness was not a discussion and people did not seek help for mental illness. The interviewee does not turn to others when feeling depressed due to their upbringing and does not cope with the depression. The interviewee experienced mistreatment from a relationship they were in earlier in life. The abuse contributed to low self-esteem. Due to the abuse, the interviewee became very religious later in life. Religion and spirituality behavior contribute to positive psychological development in adulthood. Religion and spirituality involvement also contribute to a positive self-esteem, emotions, and well-being. Due to becoming pregnant at the age of 16, this had hindered the interviewee from graduating high school. The interviewee is very disappointed in herself for not being able to graduate from high school. The interviewee had to work and raise a family and could not finish school. Once the interviewee met the adulthood stage, they were supported by family and teachers to pursue their GED. During the interview, the interviewee discussed the difficulties in getting their GED, and the most difficult part, they explained, was the mathematical section. She explained that without the support of the teachers during the GED process, she would have never further pursued her GED. The interviewee is supported by their church community to meet their goals as well. The second approach that I did for this assignment was the biopsychosocial approach. This approach looks at social factors. The biological level considers individuals' diet, health, and any biological functioning and how it affects the individual. The psychological level looks at the individual's self-esteem, coping skills, mental health, as well as spiritual development. The social level looks at the stability of their work, recreational activities, and social activities, as well as their relationships with peers and family. In the biological level, the interviewee had stated that she has a strict diet due to a poor self-image. She eats very small portions and eats only at appropriate meal times. She avoids all fast food restaurants. The interviewee does not belong to any gyms and does not exercise at all. For medications that the interviewee takes, she takes vitamins, diet supplements, and depression medication. The interviewee does not have any history of substance use. The interviewee's health is good and there are no signs of health problems. However, the family history has a history of poor health. Between her sisters, they have a very poor history of health issues chronically. For the psychological level, the interviewee stated that she has a low self-esteem, And the interviewee states that she is shy and she has a constant desire to make others like her. The interviewee has a history of depression, and the interviewee does not cope well and tends not to seek out treatment when is in need of help. There are no known family history of mental illness because they did not believe in seeking treatment. She has a strong spiritual belief system. For the social level, the interviewee has been stable at the same job for the past 36 years. She is very hardworking and she shows up to work every single day. She's been through all of the different management at her job, and she still continues to do the same job. Even after she looked forward to retirement, she still didn't retire. The interviewee engages in social activities such as attending church and family gatherings. The interviewee has a good relationship with her family. However, she has a very limited amount of friends. She does communicate with some people outside of her family, but it's very limited, and she doesn't go outside of her family circle very often to hang out with a friend network. For the theory limitations, the limitation of the biopsychosocial theory is, I noticed that it mainly focused on the negative of the interviewee's life. A lot of it was focusing on the poor habits of the interviewee, such as the poor diet habits and the poor psychological history or the family health history of the interviewee. The theory does not look at all aspects, such as why the individual's diet is the way it is. Such things that could make the individual's diet poor could be a lack of resources. Another thing that could make an individual's diet poor could be their poor self-image. So in my interviewee's case, she eats very small meals due to her poor self-image, so she tends not to want to eat large meals or any snacks because she's very self-conscious on the way she looks, and she doesn't want to overeat because she's concerned on gaining too much weight. The theory also does not look at aspects from the interviewee's life that could have impact the psychological level, such as the abuse from a relationship the interviewee experienced or the losses of their children. So it discusses her psychological level, however, it doesn't discuss factors that can contribute to her psychological level or her personality. So other things to consider could be why she's experiencing the depression. So she could be experiencing the depression due to the losses of her children and not properly being able to cope with the losses of her children. Another thing that she could suffer from is the abusive relationship that she came from, which could have impacted her views on life. And these are my